Kaylee suffers from tight upper traps that have been causing her pain as well as decreasing her normal neck side flexion range of motion. I will begin treating her with a single hand technique in order to lock down the tissues as well as stretching the upper traps by sliding my fingers along the tissue in order to release the myofascial tension. I will do this for approximately 90 seconds or until the tissue releases. The next technique I would do is circular friction. First, I would find a myofascial ball and compress into the tissue in a circular motion. I would do this until the muscle releases, or less than 2 minutes. In doing this, the muscle fibers will realign, hopefully decreasing the myofascial ball that started at the beginning into. Another technique I could do is Graston. In doing this, I will stroke along the muscle fibers in order to decrease adhesions that could be causing her discomfort and her range of motion restrictions. You could also do this with them seated in order to stretch the tissue as well as glide the muscles in order to release any tension that has been built up in there. I will stop performing this technique whenever petechia starts to form, as you can see here on her skin. This is a prone thoracic manipulation. I would use this in order to increase joint mobility and to ensure that if anything is stuck, then I would be able to unstuck it in order to realign her vertebrae and inadvertently hoping to decrease the pain that she's been having in her upper traps. This is a cervical manipulation. I would use this in order to realign and release any adhesions that might be in the cervical spine, as well as increasing the joint mobility. You would first extend the neck, side bend away from the pain, and rotate in the opposite direction. After performing these techniques, you can see that Kaylee's side flexion has increased.